So they doing the pledge there?
Yes, I was going to open the meeting. That say so. I wouldn't remember. I'd like to open the meeting for Health and Human Services and do the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. We have our meeting tonight, and then we have the special budget presentation after this. So we'll try to get through this meeting tonight as expeditiously as we can. Tonight we have 12 resolutions on the Health and Human Services agenda, and we do have 2 appointments. There's 2 resolutions from the Health Department, 7 from Social Services, and 3 from Mental Health. So I'd like to start to entertain a motion to approve the minutes of October 12th.
I'll move them.
All in favor? Aye. Okay. I do have to open the public hearing again for the shared services plan. Is that true? Okay. We are going to open the public hearing. Anyone, if there's public to be heard, they can call 315-294-8051. And again, this is in regards to the shared services plan for 2023. I think at most of the committee meetings, we're going to be doing this. The appointments tonight to the Mental Health Subcommittee of the Community Services Board. There's an appointment for Jonathan Lane, 3 Washington Street, for a term of 1/23 to 12/26, and one for Timothy Gunnavan, again to the Mental Health Subcommittee. The appointment is 1/23 to 12/23.
A little delinquent on there, huh?
A little bit, yes. Yes, a little bit. That is correct, isn't it?
January 23, not 24. I'm not 100% sure about that,
Okay, so
but I think
it might be one that we hadn't done in the past.
it was a empty seat in the subcommittee that stayed that way for a little while.
Okay, till the reappointment. Okay. Can I get a motion for those 2 appointments?
I'll move it.
Second?
Second.
Okay, all in favor?
Aye.
Okay, we have, as I said, the Health Department with 2 resolutions, but maybe we could just quickly have Deb come up, and if there's anything she wants to talk in terms of the Youth Bureau, more than happy to, and then Brenda can do question and answer if she wants anything to report to the committee tonight.
I have my update here. I don't know if anybody has any questions on that, but I will just give you a couple of updates on top of these updates with as far as the applications that have been received so far for 2024 for the Youth Bureau request for OCFS funding. I do have 10 applications in. I also have 2 ARPA requests in that I have sent to the committee today to begin to review, with one potential other one coming through as well. So that's exciting because there are a lot of organizations who would be newly funded once again and outside the city of Auburn that have expressed interest in funding.
Do you have enough funding with OCFS money for all the OCFS applications you have?
I don't, because that's one thing that I was going to, the committee and I will speak about. Some of the asks are very high. They're higher, and they all say they would accept less, but they're very high in relation to the amount of money that we have. So we'll meet and discuss reducing their funding requests, but I think that we might, as of what I have right now, I think we should be able to give everybody at least something. But yeah, some of them are a lot higher than we've ever given out. I have one requested for $85,000 for an example. That's pretty high. The most we've ever given out, I believe, to one organization is $18,000.
Same criteria as the ARPA funds?
Yeah,
pretty much. So
Yeah.
some might be moved to be considered by.
There's one in particular now that I know of that could possibly go for ARPA because it's new youth programming. The ARPA criteria for invigorating some of the teen opportunities. And Student Government Day, again, I just want to thank everybody who participated in that and worked with the students and the youth, the department heads. I really appreciate everybody's help in coming together to make the day successful. I enjoyed it. I hope everybody else did as well.
Fun.
So
Yeah,
It was
lovely.
Very good.
And that's all I have for this evening. Questions?
Thank you for putting it together.
So you do hope to bring something in December, potentially for
Yes.
awards?
Yep,
Okay.
yep, I would like to at least we'll be meeting, our committee's scheduled to meet, one of the chair of our committee accepted a new position, so he can't meet until a later time, so I just wanted to touch base with the other committee members, just to see if we could meet at a later time or do something possibly on Zoom to review all the applications, and I'll send them out for everybody else, for everybody on the committee to review before we meet, so they have that information ahead of time to start going over.
Are you still hoping to meet on the 30th?
Yes, ma'am.
Okay, gotcha. All right.
Thanks, Deb. Great job.
Okay, Brenda?
I even have a folder in my hand. I don't have any resolutions. It feels strange. I just wanted to talk about our meal program. I've done a lot of work as far as trying to reach out in the community, answer questions that people have had. We did open that one RFP that we received this afternoon, so that is still to be evaluated but what I wanted to kind of just convey tonight is the thing that we are still in need of is a location for staging the food. So we have multiple routes that the food has to go out on, and unless there is a local entity that's actually got their own kitchen and doing their own meal service out of that kitchen, if we have a vendor that wants to provide us meals by dropping off food in a location, which is looking more and more like that's what we may have, we need a location. The location needs to have a place for volunteers to be able to park, a place for staff to put together perhaps a cold bag that goes with the hot meal. So a little bit of workspace and some overnight storage for some meal containers. So that's the part that we are still little kind of the fly in the ointment, that to be able to move forward, we have to have that. So I wanted to convey it to all of you as community members that may know of some place or can help get that word out. We're looking for right now, preferably here, in Auburn, centrally located, or we could do a couple of different spots potentially. But about 350 meals, about 20 to 30 cooler size containers, and then a workspace. Like a sink at least to be able to wash hands before we start putting some of the cold bags, like putting the milk in a lunch bag and things like that as part of it.
Madam Chair, I have a question.
Go ahead.
So how often do you require this, and like what times of
5
day?
days, yep, 5 days a week, and between 9:30 and 11 typically. Maybe a little later for volunteers to return the containers back.
I have a question about that too. Is this a space that you would pay for? Or are you looking that you'd be able to, like it would be a donated space?
Of course, we'd love it to be donated, but
Right. It's
we have a budget that it could come out of our budget if need be. Yeah.
I was just thinking like there's empty, restaurant fronts and like small. I didn't know if that was something that would be
I know that would,
workable.
yeah, something like that would be great if we could have access to it. Just
Is this a new part of because of the vendor not participating with us?
correct. That's a good question.
This is
So
a new
you need-
kind of need?
Yes.
Okay.
Our current vendor also serves Loretto Nursing Home, so they do our meal program out of that same kitchen. Our volunteers go to Loretto. We have a breezeway little area that we're able to get our meals and take back our containers. Yeah, and we don't have that anymore. Yeah, good question.
Did you say you need refrigeration storage?
It's possible, depending on the particular vendor's ability to provide meals that day, or if we're gonna need to stage some things the day before.
Okay.
So maybe not as critical as just the space. But we have access, having access to the space the 5 days a week. It would be a bonus at this point to have the storage, cold storage.
And for parking, like how many volunteers, staff?
Yeah, about 15 volunteers need to come in and out of there, and one staff. Plus the vehicle, I'd be a van most likely for you.
Go ahead, Dave.
Yeah, Brendan, that was a good idea at the mall. The new owners of the mall are coming into town next week to meet with me.
Okay.
So can you send me an email exactly how much space you would need and what you would need?
Yes.
And I will forward it to them and see what we can do.
Stick.
Thank you.
Didn't, Mike Chapman, who sits on the advisory, talk about the other, potentially the hospitals, the old nursing home space? Are there other facilities like the Commons that would?
I've been following every lead I've had, and I've not on anything definite yet. So I was hopeful after talking to the hospital, but I haven't heard back.
I mean, Auburn Nursing Home, that wouldn't be a possibility, or?
No, most of the places I've talked to have said we're kind of at capacity, serving our own folks at that time with our limited staff.
Yeah.
And 350 extra meals, you know, most of the other nursing homes are smaller, so it would be a huge jump.
Thank you.
Thank you, Brenda.
Hey, Kathleen? I'm wondering, we could get your two resolutions done too. I'd like to group together HH1 and HH2. And then get a motion and then open it up to questions. HH1 is to contract with City BOCES for cardiology services for the 3 to 5 program. And the next resolution, HH2, is to enter into a contract to accept almost $78,000 for the health department's preparedness contract with HRI. I could get a motion and for HH1 and HH2, and then we can open them up.
I'll move the bundle.
Second?
I guess I,
Yep, I mean, is this new audiology contract?
Usually every year we have to contract with this agency, they're a unique service.
Yep.
That we need to provide.
So it's kind of a contract renewal to get these services
Outside
done.
of our typical preschool.
And HH2 is to accept the grant that you've been getting year after year for health preparedness.
Correct.
Any questions about HH1 or HH2? Okay, all in favor?
I,
I'll be brief. I know there's a lot going on. We're still working on filling some positions. We anticipate having our WIC nutritionist filled by the end of this month. So that's good news. Still looking to fill a public health senior educator and director of community health services. We had some communication today with Shalene and Diane Ferris, and we'll see what we can do to get some professional assistance in looking for that position, because that is, it's a critical one that we need to have filled and have not since February. Had a number of outreach events, just a lot during October that many of you have seen and participated in. A lot of them were related to Halloween time. So a lot of healthy neighborhoods outreach, a lot of general outreach around the community, and it really has been throughout the county. So seen the health department cars on the road, which is good. We got good news regarding WIC, that just this afternoon, that the rate for WIC benefits will remain at the current level through next year, through September 2024. So that's really good for participants. It'll make a big difference for them. And we are applying, I wanted to talk a little bit more about this. This is, a lot of attention is being given around lead poisoning prevention, right? We have our enhanced lead poisoning prevention grant, which allows us truly to do more preventive care and going into people's homes and identifying hazards before a child is poisoned. We also have a lead registry that we are needing more information from the state. That's something that's going to be unique to property owners, landlords who have multiple units, and we'll learn more as time goes on there. It's, in this case, that will apply to 13021 when that is executed. So the city of Auburn and then the donut towns that are within that zip code. But we are also applying, this is a really beneficial grant for a lead replacement grant. So there's some funding that's coming down through the state, not through the health department, through another agency, Department of State, to provide funding to the counties that have these areas of high risk, these areas which we are, which is why we have this supplemental funding in this registry request. This will allow us to have $40,000 to put toward qualifying homes to replace friction surfaces, so doors and windows. And it will be for landlords to apply for this.
Say that again?
What's that?
You said what, doors, windows, you said?
Doors and windows, yeah. So where the majority of the lead paint flakes off because of the high use friction of opening and closing the windows, et cetera, and slamming the doors. So we're really excited about this. The application's going in. There's of course not a guarantee, but only those counties who qualify can apply for this. So the odds are very much in our favor for getting some funding for this. It would be for 2 years. It's not a huge amount of money, but if, we're hoping we can serve, up to a dozen homes a year. I think the hard part will be finding contractors who have the appropriate qualifications to help with this, but more to come on that. But we're really pleased that this is an opportunity that really has been probably the biggest gap when working with property owners, be they individuals, private property owners or business. It's their business through renting to have the money to replace the parts that need to be replaced. So it's good news. Great, thanks.
Thank you.
Thank you.
Thank you.
No.
You have, the first 3 resolutions, HH 3, 4, and 5 are contracts. So if you want to go through those, and then we'll get a motion for those 3, and then open it up to questions if there is any.
Okay. So HH3 is looking to enter into an agreement with QTrack, which is a company that would help us to provide a software solution for our 3rd floor intake area where folks come in and are needing to speak with someone, they're seeking services. It's a ticket system, queuing system where they take a ticket, helps us to get people through efficiently, quickly. The provider that we were using is no longer supporting the product that we have, and we've actually had some issues with them even prior. So this, I think, is going to be a good solution. We worked with IT on this. My understanding is the Department of Motor Vehicles is also going to be seeking a contract with the same company. HH4 is for us to do a contract with Cayuga Centers for Diversion Case Management. This is for youth who have committed some sort of a minor criminal offense, and it's a case management service to help, divert them to court, that provides some services so that they don't end up, penetrating that criminal justice system even further by going into detention or placement. So we're seeking to contract with Cayuga Centers for this case manager who will provide this DCM service. HH5 is we're looking to contract with the Employment Training Department of Cayuga County to provide employment services and training to people who are on public assistance. This is, we're looking for 2024.
I think it's
All
5
the way
years.
for a few years, yeah.
5 years.
Yep. January 24 to December 31st of 28. Yes, and then it's incremental increases through those years. That was 5.
Yep, no, can I get a motion for HH 3, 4, and 5
I'll move it.
in a second?
Second.
Any questions about any of those contracts? All right,
Just a really quick question. The 5-year contracting with the county employment and training is a typical timeframe?
That we've done before. We've been contracting with them. I think that what's different about this resolution is that we're doing a small incremental increase in the amount of funding that we give them each year to help them out, with the cost, their increased costs.
5 years is the most you can contract, Rich, is that, I used to hear that before, that generally you can go up to 5 years, not longer. Okay, any other questions on any of those? Okay, all in favor?
Aye.
Any opposed? Okay, great. And then HH 6, 7, 8, and 9, if I'm not mistaken, are all requests to fill budgeted vacancies. One from resignation and the rest, or one for retirement and the rest from resignation.
That's correct.
Okay.
I'll move 6, 7, 8, and 9.
I second that bundle.
Any questions? I see you're losing another full-time caseworker.
Yes. Talk about that in a little while.
Yep. Okay, but, all right, any questions about filling these budgeted vacancies? Not, all in favor? Aye. Great, okay. Yeah.
I just had a few things that I wanted to mention. Another one. Not to do tonight, but I did want to mention that the HEAP program, the Home Energy Assistance Program for this year opened on 11/1. There's quite a bit of information on the county's website for folks. If you have anybody, constituents or folks that are interested in that program, you can go onto the county website under DSS and HEAP tab, that page, and there's information about income guidelines, where to apply, how to get in touch with folks at those places. So good information. The emergency HEAP component, which is for folks who have utility shut-off notices, does not start until the beginning of January. So right now, it's just the regular HEAP benefit for folks that are categorically eligible.
Want to make sure. Let me know.
So that's good news. Emergency housing update. So we have definitely entered the time of year where we are obligated to provide emergency housing to individuals and families who are homeless, regardless of their situation, if they've been sanctioned from, benefits here. We have seen an uptick, I believe, in the last week because of the cold weather. Big jump in numbers even from last week to this week. Currently, we have 97 single individuals that we're providing emergency housing to, and 33 families. That's up 10 individuals and up 2 families from last week. So we're seeing the trend up. I did pull some numbers that just to give you kind of an idea of the scope of the number of people we're serving through the year. So far, year to date, pulled today, we have served 399 adults and 181 children in emergency housing here in Cayuga County. Big numbers, larger number than we've seen already. We're not even through the year. We're already seeing larger numbers this year than in 2020, 2021, and 22. So it is definitely on the rise and increasing. One of the big things that we noticed today looking at this is the number of children. Last year we served 123 children. This year we've already served 181 children. So more families in housing, more families, that means more families in hotels. And I think one of the big drivers is just like I talk about every single month, finding homes that are affordable for families is so very difficult. So people are lingering much longer than we'd like them to be in emergency housing.
Camille Johnson talked about the school having to bus these families from the hotels where they are.
Yes.
And the issues that they're seeing
Yes.
too. Yeah.
That's an update in that area. On the caseworker vacancy area that I talk about pretty much every month as well, we currently have 6 caseworker vacancies. That's the same number that we had last month when I talked. We actually did fill one position, then we had another resignation by a caseworker to take a position at the hospital as a social worker, making far more than our caseworker positions pay. Just wanted to kind of recap what we've done so far, in talking about this over the last several months. We've had discussions with Diane Ferris. I've talked to Elaine Daly and Chairman Gould, has been involved in conversations about our concerns related to, internal equity and external equity, you know, pertaining to the salary for our caseworkers. You know, this, it's been such an ongoing problem, and it's definitely at the forefront of our concerns around how to manage the work and how to, you know, provide some relief to the staff, get caseworkers in, keep them, the ones that we have. It's been very, very challenging. We have been in the process of gathering surrounding counties' data of their caseworker salaries, what it looks like for them, starting salary, the grades that they have, how it progresses for their range. And we have compiled some information, and we actually provided that to Diane Ferris today, so she can have a look at that. You know, our look at that preliminarily, we need to analyze a little bit more, but it does seem like the surrounding counties have the higher end of their, you know, where they come in to where they can end up, that where they end up is higher, in some cases much higher than other counties. I think that's part of the struggle. So I just wanted to talk about that a little bit. Let you know where we're at. We'll be having more conversation.
They could potentially get more steps, I would assume. But since these are unionized positions, this is something labor talks with the union about, or management talks with the union about, correct?
Yes.
Yeah, John wrote an email to Diane today asking us like what are our next steps to you know, have more conversation or come up with a game plan on to see if there's some way that we can work on you know, looking at adjusting these. I mean, I think it's just not sustainable for us to continue to lose caseworkers every single month.
You're talking about a grade change in the union contract, increasing the grade for the salary and the grade.
Yes, you're looking at a grade change for the caseworkers, and it'll have to be the supervisory folks above them too, because the compression is so tight.
The grade now is what?
Grade 17 is what
17.
the caseworkers are. Grade 19 is the seniors. So that's where we are with caseworkers. And I just wanted to say that to end on a good note, we have brought in our full-time attorney this week. He started on Monday, and he's you know, hit the ground running. And we also have contracted with an attorney who has started this week doing our child support court, which is 1 day a week. And that has provided some relief to Chris Palermo, who had been sitting in and doing most of our child support court. So I'm sure that's
Progress.
yes, that's
Any other
progress and helping a little bit with the strain on the county attorney's office. So
Great.
I'll end on that.
All right. Okay.
Thank you.
Thank you.
Yep. Dave.
Chris, I know that, was there a second interview too? Are we looking at someone else? I think.
We did interview someone else, and that particular individual was not interested in a full-time position with the county.
Okay, that's disappointing. I
Yeah.
thought that looked promising.
Yes, it did.
Is he interested in a part-time or a contract or?
Maybe interested in a part-time.
Oh.
Yeah. So we're gonna talk.
Thank you.
Okay.
Thank you.
Thank you.
Hey, Lauren, not last but not least. These are all pretty different, so if you want to just start with HH10.
Yes, so this is new OMH state aid that came to the county for integrated supportive employment services to help people with serious mental illness be able to work on, you know, different job skills and be able to help them gain employment. So that is a contract that will be going to Unity House, who previously had you know, done these services in the past. So they'll be getting the contract for this state aid funding to be able to start that up again.
This 90,000. Correct. Can I get a motion for HH10?
I'll move it.
Any other questions about having the state aid? Okay, on favor?
Aye.
Bye.
Then the next one is opioid settlement funds. So the Community Services Board met again, and we determined that we will continue funding to the same programs that were funded prior. So that would be our countywide, you know, substance use response, plus CAD is providing an additional prevention counselor, and they're working with all the different school districts to provide that service in the schools. And then Nick's Ride is providing peer services in the hospital to be able to connect people with resources and services following discharge from the hospital, as well as they have there's kind of two that go to Nick's Ride. One's a smaller amount, but that's called like for the Breaking Barriers Fund. So that's anything that gets in the way of somebody needing treatment or needing to get into treatment, that we kind of take care of some of that, whether that's they need minutes on their phone or they need to stay in a hotel for a night, a safe place before they go to treatment. The only one that we didn't fund again was Cayuga counseling, but that's only because that program hasn't started yet. They haven't been able to hire someone to start that. So we will revisit that when it gets to be kind of a year through that program.
A motion for HH 11?
I'll move it.
I'll second.
Any questions? In favor?
Aye.
Aye.
Right. And then last, but unfortunately, yes, this will be the 2/3 vote at the legislative meeting. This is taking money. Go ahead from.
Yes, so this is taking money from the fund balance to put into the budget to cover, this is for the 7:30 evaluations. Well, not necessarily evaluations, but the restoration that comes when somebody's found to be incompetent. So we have one person there. I'm just giving you a warning that there are 2 more people that just went this week, and we just had another person found incompetent yesterday. So I think there will be probably more resolutions coming to adjust that, but this is to kind of catch up with this year.
Can I get a motion in a second? And then,
I'll move it.
I can go second.
okay, and Lauren, these all start out with court. And court says.
So a judge
you're not
or a
competent
defense
to-
attorney or any attorney can order a 7:30 evaluation, and then two of our psychiatrists have to go. If they agree, it's done there, but if they disagree, there would have to be a third psychiatrist to kind of break the tie to figure out if the person is competent or incompetent. And then if they're incompetent, they go away to a state hospital where we pay the full 100% cost for OMH for anybody that goes for restoration. And that really could be anywhere from 90 days to a very long time.
To determine if they can restore
Be
them
restored.
to competency, and then once it's determined they.
Can or can't. If they can, they'll return to the jail and they'll, go to trial or face the charges that they have. And if they don't, then, they'll go to a facility for their sentence.
I have a question. I feel like we've talked about this before, but we're obligated to do this, right? There's not really a discussion.
Option, yeah.
The county's responsible for this.
Good try.
Go ahead.
So you said we have 1 and you have 2 that may be going?
Yeah, so it's a pretty high rate. It's like over $1,000 a day that they go. So it depends. The state hospital set the rate and we don't really have a choice in that either.
Do you find that your psychiatrists ever determine that they don't agree, that they feel they are competent?
That rarely happens, that they disagree.
Right,
It'd be rare that they
right.
disagree, yes. But that has happened. It happened last year, I think, when they
And then
disagreed.
the third
We had a
psychiatrist comes in.
Yeah.
Good.
So we have a contract with Upstate for the third psychiatrist. We need them. We haven't needed them yet, so this year.
Lauren, what qualifies as incompetent?
So if they don't understand their charges or what their crime is or what the court process is, it's not like a psychiatric evaluation where someone could be very ill or psychotic, right? But they could still be competent at the same time. So it's really about understanding their charges and what.
They don't understand, they go away. And then they're supposed to come back understanding,
Yes, that is true.
Our number
to
of
understand the charges.
Well, so I know it sounds like as if like, can anybody really be restored? So this is like a huge thing with the state. They're really trying to advocate for the law to change and for things in the law to change because people have gone to restoration for a number of years without being restored and have stayed there. And that's really not ideal for the person. There's other ways to get the person treatment and to be able to have them, get back on their medication, whatever that might look like, but it's definitely, it's not always the way of competence.
Just saying, I wouldn't
That's the way to
know,
do that.
I wouldn't know if somebody was like faking you guys out, would be the motivation to say I'm competent.
I mean, the psychiatrists have a
Go to jail.
they have a whole assessment that they use
have
in
to
order
be
to
crazy.
determine that. It's not
Yeah.
just like, hey, do you know why you're here? Like, there's a whole, like, they have a whole thing that they follow in order to determine competence.
I'm sure it's
So-
well vetted.
some people might have mental health issues at the time, and some may have developmentally, they might be developmentally disabled, and that would be even more difficult.
To restore. I have seen somebody that's incompetent that's gone and been put back on medications that comes back and fully does understand what the charges are and what they're facing, and that's restoration, I guess, for OMH purposes. Yeah.
What if you were, this is a crazy, and then I'll stop. What if you were incompetent at the time you committed the crime, but then you got restored?
I don't know.
Yeah, I mean.
But it's just the time, right?
Elaine, I'm just a little nervous about this question.
Yes, right.
The way to ask the question.
Yeah.
Planning something.
Yeah, I know. All right, thank you.
I just one more question about what we pay. So if an individual is found incompetent and then referred to the restoration, and that's a state hospital situation?
Correct.
We pay that $1,000 a day the entire stay?
It's the rate is set ahead of time, and it varies, but not too much from each hospital, each state hospital is a little bit different.
And that stay is not for assessment, that stay is because the
Restoration.
assessment indicated restoration and.
Yes. And it's up to the state hospital doctor to determine when that restoration happens, or doesn't happen.
What's the average amount of time? You got like a mean?
I don't know, we could go back and do a little research on that, to figure out if there's an average, what the average looks like. I mean, we've had a couple people, since I've been here, which has only been not even 2 years, we've had somebody in there for quite some time. Yeah.
Oh, certainly, go ahead.
I was just gonna mention it wasn't too many years ago that the state actually covered part of the cost, but they just basically pushed 100% off to the
It
local
was
municipality,
50%.
so.
OPWDD still pays 50%, but almost does not. We're
I think there's a
responsible for 100%.
motivation. You want to say, you know, I don't know, it's just, so there's no trickery in the system. Like there's a vetted system that this person's incompetent and they have, well, okay.
Right, and they have to be able to aid in their defense too, that's one of the, not just understanding the charges, they need to be able to aid their counsel in the defense as well as understand the charges, so and to be restored to that point.
I just had like.
Did we vote on this?
I'm wondering if you did.
All right, we got a motion, a second.
Elaine?
Yes,
Before you vote on it.
Okay.
The title of the resolution is authorizing a transfer from the general fund.
Yep.
And the body of it says it's coming out of fund balance.
well, that's,
I think after this went through the budget officer, she said, no, this has got to come out of fund balance, not general fund.
Okay.
isn't that one and the same?
No.
The general fund and the aid fund, I thought. Okay. Lynn Marinelli.
So we have,
Lynn, are you on? I know she's in the office.
Yes, I would say it is the same.
Yeah,
The aid fund and the general fund is what it says?
general fund and fund balance or a fund are the same, aren't they?
Yeah, it's okay.
Okay,
All right.
stand correct? I'm sorry.
No problem. All right, either way, we're paying.
Yeah.
Yeah. Okay, motion and second, we got Sarah?
Yep.
All in favor?
Uh,
Aye.
Okay, I just had just real quick
Yep.
updates. We have 3 social work vacancies at the clinic. We just filled 1, and the two of them are because of the SAMHSA grant that we just received. So those 2 positions are in there, but we haven't received really any applicants so
It's for the
far.
DBT.
It's been pretty
That's the
dry. Yeah,
DBT.
yeah, it's to cover
Yep.
for the therapist to be able to go to the schools to
Yep.
do the DBT in the schools that I had talked about previously. So just that, and then also our deputy director is retiring, so she gave us her letter. So that will be at the beginning of February, so I'll likely try to bring a resolution forward next month so I can start interviewing for that position to fill it, because it's a pretty important one. I'd like to have time to be able to interview for that, so just giving a heads up about that. It's gonna be hard to fill their shoes, but we gotta start to figure that out, so. And then Also, there probably will be some resolutions coming forward for opioid settlement funds. There's a couple of different projects on the table. So once I meet with this community services board this month, we'll likely try to move some of those things forward. So just kind of another heads up for everybody. So that's all I really have.
Yeah, then Liz will be coming back part-time, we hope,
I hope so.
Okay,
That's the goal.
because we did talk about that.
Yes,
Yeah, great.
yes, she wants to, so
Okay.
that works out, yes,
That would work out great.
yes.
All right, thank you.
Thanks.
All right, there's no further business. We'll get a motion to adjourn.
I'll move it.
Second.
All right, great.
We'll give the 5-minute break and then we're gonna start the special ed meeting for the budget. Okay, thank you.
So,
Everybody, hey, hold on, we're not done yet. Would you just close the public hearing?
yes, we'll rescind the motion to adjourn. I'd like to officially close the public hearing on the shared services plan for 2023. All in favor? Aye. Aye. Thank you.
Thank you, yeah. It's all yours.
Okay, Eric, go ahead. So today we're gonna do the presentation for the 2024 budget. Some of the budget goals that we had while putting this together, we have included a minimal property tax of 2% increase. This is below the tax cap. For us this year, the allowable limit was estimated to be a 3.5% tax increase. There was a tax calculation that includes several different tax adjustments, pilots, chargebacks to colleges, and we actually are allowed to carry forward tax increases that you could have applied in the prior year to the current year. So there's a formulary that we get from the state controller's office. That's why there's a differential between the cap that you hear about 2% or inflation, or actually is a statutory level that we could raise taxes more and still be technically within our individual county's cap. We calculate that every year. This year would have been 3.5%. We also made sure we managed, let's see, kept our fund balances within the county's fund balance policy, and that would be, the policy states as 10 to 15% of the gross revenues that the fund balance should be within that range. We have included some investments in capital projects and some repairs in this budget. And we have had some strategic investments in some county operations, including the sheriff's department, the highway department, information technology, and the parks department. This next line here is a summary. This also was in the front page of your budget book. It gives you an overview of the breakdown of the total appropriations by fund, the revenue that we have coming in by fund, the interfund transfer, that would be the transfer from the A fund to the highway fund for its operations. And then the column shows the amount of fund balance that we're proposing using in this budget. Bottom, the property tax levy, $43,592,000, and 2% increase. And for information purposes, I mean, the total appropriations on here is $188 million. In 2023, it was $171 million. It's an 8% increase in expenditures. This next graph is just a visual for you for the tax levy, to show you how it's grown over time from 2008 to the proposed 2024 tax levy. I like to talk about some of the budget pressures that we were facing putting this budget together this year. There was an increase of 9.5% in the health insurance premiums. The budget impact was mainly for retirees. The retirees, their contribution percentage that they pay does not change while they're in retirement. So as the rates go up, we really can't get any more participation from them. So for active employees, it really didn't have much of a budget impact. During union negotiations, we were able to hold that a little bit flatter. There was a 3% increase in the contribution rates for the retirement system. That resulted in about a $1.3 million increase in what we're going to have to pay to the retirement system next year. The bill is went from about 5.7 million to about 6.9. So it's a large increase for us to have to pay. Those rates are given to us by the state controller's office of what we have to pay. And just for your information, they do range the rates from about 10% of an employee's salary to 27% of an employee's salary. It depends on the tier that they're in, and then the rates are actually much higher for law enforcement since they have a 20-year retirement for the road patrol and CX. So we don't have any control over that. These are just set things for employees, but it's having a big impact this year. It's also obviously actuaries determine these things based on the stock market, based on the number of people who are drawing benefits. So a lot of complicated things go into them sending those out to the counties, but this is what we have to pay. We've also included an investment in some sheriffs and jail vehicles. We have included 10 vehicles in this budget. One of the things that we've had to deal with is we've had to at least quite a few vehicles some years back. They're all hitting, not all, most of them are starting to hit the end of that lease. So we're having to purchase a little bit more than we normally have had to in past years. We also have in this budget salary increases for the employees. All the union contracts have been settled for 2024. Those are included in here. We have some capital investments in buildings and IT, as I've said. Another large impact to this year's budget was the Medicaid increase in the costs there due to a loss of federal aid. The Medicaid expenditure is going up $1.6 million. So it's going from 13 million to 14.6 million. The issue with that is the state had kind of told us that it was going to be a 3-year phased-in effect. Due to the state's calculations of withholding federal aid for EF-MAP and determining that they had overpaid us for some other federal aid, the resulting answer is that we're going to be paying $14.6 million and our cap is $14.7 million. We're basically having to absorb almost the whole increase in 1 year instead of being spread out over 3 years. And again, they just sent us a letter in August that said this will be your payments going forward. So we have no control over that. We also have some increased investment in the highway. We have increased the transfer of funds to the highway fund from 7.4 million to 7.7 million. We have also some increased costs in the assigned council program, which you're well aware of with the rates going up, and that impact on that in our budget is $490,000. And we definitely have increased costs for almost everything, whether it's parts, services, repairs, contracts. I mean, obviously inflation is affecting all the people that we do business with. So overall, the whole budget, I can't pull out exactly what they are, but they certainly are impacts across the boards. Everything is costing us a little bit more, whether it's the meals that we hear about, whether it's the doctor's appointments that you hear about. It is flowing through to us too. There are a couple positives. The slide isn't quite as full. There's been an increase in the sales tax budget that we have been able to increase again due to some strong performance. The budget is going to be increased $2.8 million. We budgeted $27.7 million in 23, and I'm budgeting $30 million in this year's budget. It's an increase in budget of 10%. The sales tax collections this year, I'm estimating to come in at $29.9 million, so we will be over by almost $2 million there, so that's a plus. And the budget that I'm including of $30.6 million would be a 2.3% increase over what I expect to receive in 2023. So it's up a little bit. We also are proposing to use capital reserves and ARPA funds for a few investments in capital. This slide is a summary and a little bit of an estimate of the fund balance. At the end of 2022, the unappropriated fund balance was $25 million. I'm estimating that at the end of 2023, we'll be at $28 million. That's before appropriating any funds to the 24 budget. So we had planned on spending $3 million in 2023. But we aren't going to do that, basically because sales tax is coming in at about $2 million over budget. And just generalized savings, probably in spending throughout the budget. We certainly have had a lot of vacancies that we've heard about. And then you end up saving in your health insurance, all of your fringe benefits. So that's kind of an overall service. So 2023 should end pretty solidly, pretty even. So at the end of 23, we'll be at about $28 million. And then we're going to propose in this budget $6.9 million. That will then bring us down to an unappropriated fund balance at the end of the year of $21.2 million. That does put us within the range being 16 million to 24 million. Okay. Now, although we're budgeting to use $6.9 million, I do say, obviously that's an estimate. If, again, we have a lot of position vacancies, we wouldn't end up spending it all. And if sales tax performed better than what I'm budgeting, again, you won't end up using the fund balance. I think we're all, hearing things, people, financial advisors, at some point, we're thinking things are going to stable off. Might even be a dip in the economy, and it still hasn't happened. But as you'll see, I have another graph later that shows the performance of sales tax budget, and they're starting to level a little bit. This is just
Will we be getting a copy of this?
I can.
presentation? Thank you.
This would just be just a graphic for you to kind of see the use of the fund balance in budgets over the years. The dark line being the general fund, the black. I think it's the county road fund is the white.
Right.
And the red is the DM fund, which is the highway machinery fund. So this is the largest by far in a lot of years.
Just one question. Okay,
Sure.
sorry. What did we anticipate, what did we use last budget for 23 of the fund balance? How much did we think?
Well, we're in 23,
Okay, but when we passed the 23 budget,
about 3 million.
we thought we'd use 3 million of the fund
Right,
balance.
and I said, I don't think we're really gonna use that.
Any of it? Okay, so, but this is doubling the use of the fund balance for this budget.
And that's because in 23, the sales tax is still gonna be over budget by about $2 million. And then we said that, you know, the continued vacancies is probably driving to a lot of the savings and some salaries. This is really just, you know, pie chart for you just to get a sense of our revenue sources and how, you know, which they impact. Property tax is the largest slice. And with the sales tax, when you add the two of them together, that's more than half of the revenue that we have to operate. We have fees, the transfer from other funds, that's marginal, that's just, funds coming from the college, actually, so chargebacks that we get, and then the state and the federal aid. And I would say almost all of the federal aid on that pie chart is related to social services. We do this. This does not include grants. When we're working with the budget, we don't budget the grants. They come in afterwards and we spend them. So this is talking about our base operations. When we do the budget. We don't include the grants in here. Okay, so this chart shows you the performance of sales tax to the budget over time. And I think what I want to point out to you here is how 21 and 22 are anomalies. So I think we've all got a little comfortable with the fact that the sales tax comes in way over budget. And I don't think that that's a normal expectation. So even in 23, you can see the difference between the two bars is getting smaller. So I would consider that to continue happening into 24 and 25. These were all due to the COVID. We obviously lowered the budget a little bit in 21 because we didn't realize how the performance was going to be, because we were in 2020, obviously, when we did the budget for 21. And, you know, a lot of strange things happened. Obviously, your sales tax also goes up with inflation, which is great. But as I just previously said, we were actually paying a lot more ourselves for goods and services also. So it's might look good on this end, but it has an effect for us also as trying to function and operate. All right, so this is an estimate that I'm making based on my estimated performance for 21, and then the use of the fund balances for each of the funds that we have budgeted here. So again, you can see the D&AM funds are going to be only about $500,000. A lot of years they've been $1-2 million, kind of low. And the A fund, as I previously said, that is within the range of the fund balance policy. The next slide, these are the reserves updated to their current values as of October. I looked and saw what they were in our financial system. So we do still have a repair reserve of $765,000. The capital reserve is $5.3 million, and the highway reserve is still $3.5 million.
Real quick.
Yeah.
What's repair?
That would be more for smaller things, like, so if you're doing sidewalks or lights or, you know, bathrooms, I mean, we kind of get differentiated by the life of the life of the
repairs, like.
Yeah, where capital would be more of a long lasting life improvement, your roof, you know, large remodeling, a new building, I mean, that could be new build. Also, clearly the capital, that would be for a new build that we have. So we do have some other funds besides just the fund balance. So we kind of wanted to share that with you. That is also for some projects. This next slide is also just a graph for you to be able to see the breakout of our expenditures. Salaries and fringe benefits, the light blue, and then the one right next to it, the red. Equipment, college contribution, Medicaid contribution is a larger slice. Debt service, transfer to the highway fund, and then a large slice to the left is really everything else that's not included in that. So that would be all the other DSS services also, would be a significant amount. This is only for the A fund. This is not for the D and DM funds. These are clearly just the A. So, half almost, probably 75% at least is your salary and fringes of your staffing costs. We don't spend a lot on equipment proportionally. And then it is all the other services for all the other departments and social services and the health department, your mandated costs, and your non-mandated costs would all be in there. This budget does include a few new positions. We had 6 new positions, full-time ones were requested. The budget includes 3 of them. They're all 3 of them are in the sheriff's department. One is a detective, one is a deputy sheriff, and one would be a clerk that's in the jail division at the sheriff's department. I probably already said a little bit of this, but just reiterating, we have continued investments in the IT infrastructure. We have included for hardware $452,000, and the software line is $1.3 million. That's not really necessarily new. The 1.3, I think we budgeted software at 1.2, but I know that Tom does include in there. It's not just renewal of maintenance agreements. A lot of it involves a lot of the big projects that he's working on when he's like putting us onto teams, or he's doing those security measures and a lot of things like that. So that is included in the software. He obviously has a lot more detail on it, but it is still a large investment that the county is doing every year. Except for 2, we are purchasing more vehicles as the leases are expiring. We have suggested to use ARPA funds to replace the elevator, which had originally been budgeted. We cut that out of here, but I mean, that might even get approved this year before we get into 2024, so that got taken out of the budget. And we have proposed, one of the things that was brought to our attention, one of the things was that we are going to at some point need a new roof at the jail, and we're proposing we would use the capital reserve to do that instead of keeping it in the budget.
Just one comment. Everything that Tom and IT is doing to this building now is going to filter over to whatever this body decides as far as the building projects. So just so you know, everything that Tom's putting in now will continue when we have a new building or remodeled building. So we're not wasting anything. Thank you.
Quick question on the elevator thing, the elevator situation, if I heard that right. So there'll be a resolution presented to.
I don't know that. I know Gary has been working on a resolution. That's
a must, whatever.
So I mean, I just took out, and he had that in here as an expenditure. We're not putting it in the operating budget.
All right,
Yeah.
Curious, but Gary's
Yeah.
trying to stay on top of
Needs
it.
to go.
Just stay on it.
I mean, no matter what happens.
Oh, absolutely.
So just a little summary for you. I mean, this budget we feel is pretty reasonable and responsible. It's got the 2% tax levy increase. That actually, I mean, if you looked at the message in the front of your book, flip to the second page behind that. It's got a little yellow at the bottom. It actually results in a tax rate decrease of 8.83%. Assessed value of property within the county has increased significantly. It's gone up 11%. So with the 2% tax increase, that's a reduction in tax rate to 8.83%, which is lower than it was in the prior year.
Can you repeat that again?
Yeah, if you look in your book, Brian,
Yeah.
on the second page, the one that has this yellow on the bottom of it in your book, the second page,
Yeah.
it shows you the property taxes and the assessed values.
Yeah.
And it shows that even though the dollar amount of property taxes is going up by 2%, so we'll be raising that much. The assessed values have gone up from 6.0 billion to 6.7. So when you factor and calculate the rate per thousand, individual homeowner rate per thousand, it's actually a decrease at 8.83%.
If we went to the three, I'm not suggesting it, but the 3.5, which is still being under the cap, that be like a flat?
No, price.
It would still be a negative, but we would just get additional revenue into the county to offset the use of the fund balance.
Each 1% is gonna give you about $400,000 extra in dollars for us to use. So I mean, the two large things that are kind of out of our control are definitely the large Medicaid increase that we're having to absorb all at once, and the large increase in the retirement payment that we also have no control over. You know, there's still, Evan pointed out, you know, there certainly was an increase in safety net expenditures and DSS due to the homelessness. That is included in here. Foster care, we have budgeted somewhat flat. We luckily had gotten more revenue to help offset some of those expenditures. So that helped that. But again, that's passed every state budget. Really don't know what we're gonna get in the next state budget. So it could go the other way. Those are just given to us based on our usage kind of compared to other counties. So they kind of allocate it out differently kind of every year and that comes with each governor's budget. So, you know, those are the things that are the unknowns. We're at the governor's budget that's gonna be coming next year. We budgeted based on what we know now. We know nothing about that budget. So, you know, I guess if you have any questions, we'll be having meetings next week on Tuesday and Wednesday. They will be the special ways and means meetings. We do have the 2 nights split into different committees. And I'll have kind of some summary reports to kind of lead us along through the departments, pointing out the major changes. There will be some more than obviously I have in this PowerPoint. We'll get into a little more specifics of a couple of the departments to help you a little bit analyze those. So we will be doing that next week.
Would it be possible to get a printout of those slides to include in the budget book? Would that be okay?
Sure.
Kind of the highlights?
Absolutely.
Thank you.
Yep.
I mean, this is the book. I'm not,
No, your highlights are great, right? Because as we're going through these, we'll be able to.
yeah, I mean, I'll just send you the PowerPoint.
Yeah,
If anybody wants it printed, you can ask us to
Exactly.
print it when you're here, but I'm just gonna email it to you and you can have it. There's so much detail to this that's why it's helpful when we go through, I think, by committee.
And
And
having
we'll kind of
that
walk you
kind
through.
of as a guide helps
Yeah.
as well, because
Yeah.
it's the highlights.
Yes, exactly, and it'll help walk you through. In the smaller
Absolutely.
departments, it's easier to pinpoint. There are 2 or 3 things. The bigger departments, we get kind of lost in that. You know, they're usually the more mandated programs. That, you know, we can, you know, Christine and stuff, the departments will be available, explain how many kids, how many families, what, getting updates at HHS today.
Right.
We're working with and why our expenditures are going where they are.
Yeah. We can send out the slideshow to everybody next week, early next week. As you can see, there's 213 pages here. It'll take you a couple days to go through it.
When the
Couple
book is
days?
organized by committee,
So,
yeah, and
Go over to your
department.
house, you can read it to me.
I am asking all the department heads in here and that aren't here, to make sure you come at your appointed date next week, please. Because I'm sure some of the legislators, if not all, will have questions for the department heads. So please attend those certain days.
Would it be helpful getting it sooner rather than later? Because I'll use it as a.
Oh, yeah, no, I can send it out. Thank you. I don't like to send it before Lydia and spoil that.
Trish?
I like to take notes, though,
Excitement.
you know what I mean? So, thanks.
I was wondering if you could speak to the positions that were requested that aren't.
There were 2 more positions at the sheriff's department, 2 more deputies, and 1 full-time position at the health department, a quality assurance position that were not included.
That were asked for and not included.
I assume we'll get more into details on that.
Someone ask questions.
Yeah, I'm sure the sheriff will be here next week at his date to explain. Yeah, Jim.
have any kind of way to separate what I'll call discretionary spending versus must spending? Is there like must be spending is you gotta do this to operate. Versus discretionary spending, which would be stuff.
I really don't have a
Don't-
breakdown by that, and we've tried to do it in past years. And when you start digging into it, I mean, some of the things we consider discretionary are like preventive services that we do at foster care. But if you don't spend that money, you're gonna end up exploding your foster care costs. So, I mean, it's almost easier to talk by department, right? I mean, it's optional. The level of your sheriff's department is completely optional. Okay, your parks department, completely optional. EMV, optional. They're not required by law, I guess. So it comes down to like, are you talking by law? Are you talking about what your citizens are asking for? Those are really determinations for this legislature to make. It's very hard. Believe me, we went through it in detail, 10 years ago, 8 years ago. We got nowhere with it. It didn't bring us to finding anything to cut or anything
Probably
to
more
do.
difficult at this level than at a town level or.
Oh, absolutely. And that's where I think that you get muddied waters, because a lot of departments might be a mandated department, but you're doing some optional things that either might help to prevent things or keep costs down, or it's services that people want, that the taxpayers want. So that's why they're in our budgets, because it's things that, people have felt are important, bring value to living here, I guess. So I mean, I guess it's up to, when we go through each of those departments, it's easier to ask a department head than myself. So I certainly don't know.
Oh, I just didn't know if there was.
No, we don't have that. And like I said, we have
No is
tried
an
to do
answer.
it.
That's okay.
No, but I think those are good questions to ask department heads when we go through the individual meetings, that they have, much more in-depth knowledge of their departments than I could possibly know, or Dave, when we're trying to do kind of everything.
Understood.
Okay, and there was a presentation tonight, as Lynn just did for us, and save your questions, write your questions down. And next week we'll be I'm meeting with, I think, six of the bigger departments.
No, it's the committees.
The committees, I'm sorry,
So it's
not
all
the
the
department, I meant the
departments.
committees.
Yeah, all the departments will be covered. And then,
It's Tuesday and Wednesday.
yeah,
Tuesday and Wednesday.
yeah.
Okay, I appreciate it, Lynn, great job, and Sarah, thank you very much for helping her. Anything else to come forward? If not, can I get a motion to close?
I'll move it.
Second, Basile.
Any discussion? All in favor?